Thyroid nodules are solid or fluid-filled lumps that form within your thyroid gland. This gland, shaped like a butterfly, sits at the base of your neck. It produces hormones crucial for regulating metabolism, growth, and body temperature. Most thyroid nodules are benign, meaning they are not cancerous. They rarely cause noticeable symptoms, often going undetected until discovered during a routine medical checkup. Imagine your thyroid as a small balloon. A nodule is like a tiny bump on its surface. These bumps can be as small as a grain of rice or grow larger than a grape. While most nodules are harmless and don't require treatment, some may produce excess hormones, leading to hyperthyroidism. In rare cases, thyroid nodules can be cancerous. However, it's important to remember that less than 5% of nodules are malignant. Your doctor can help determine if a nodule is suspicious and needs further investigation. Understanding thyroid nodules is the first step towards effective management. If you discover a lump in your neck or have concerns about your thyroid health, consult your doctor for a proper diagnosis and personalized advice. Thyroid nodules are incredibly common. They affect about half of all people at some point in their lives. While anyone can develop these nodules, certain factors increase the likelihood. Age plays a significant role. Nodules become increasingly prevalent as we age, with a higher incidence in individuals over 60. Women are also more prone to developing thyroid nodules than men. This is likely due to hormonal fluctuations experienced throughout a woman's life. A family history of thyroid nodules or thyroid cancer can also increase your risk. Additionally, exposure to radiation, particularly in the head and neck area, is a known risk factor. Other factors like iodine deficiency, once a more common cause, are now less prevalent in developed countries due to iodized salt. While these factors can elevate your risk, it's crucial to remember that most thyroid nodules are benign. If you have concerns, discussing your medical history and potential risk factors with your doctor is essential. Thyroid nodules come in different forms, each with unique characteristics. Understanding these types and their causes is crucial for effective management. Colloid nodules are the most common type. They are non-cancerous growths filled with a jelly-like substance. Cystic nodules are fluid-filled sacs, often developing from degenerating colloid nodules. Inflammatory nodules, such as those in Hashimoto's thyroiditis, result from inflammation within the thyroid gland. Hyperfunctioning nodules, also known as hot nodules, produce excess thyroid hormone, potentially leading to hyperthyroidism. On the other hand, suspicious nodules exhibit features that raise concern for malignancy, requiring further investigation. The exact causes of thyroid nodules remain unclear, but several factors contribute to their development. Genetic predisposition plays a role, as some individuals inherit a higher susceptibility to thyroid problems. Iodine deficiency, once a significant contributor, is less common now but can still lead to goiter formation, increasing nodule risk. Section 4. Recognizing the symptoms. Most thyroid nodules don't cause noticeable symptoms, often remaining undetected until a doctor discovers them during a routine physical exam. However, as some nodules grow, they might cause local symptoms. You may feel a lump or swelling in your neck, sometimes accompanied by pain or discomfort. Some individuals experience difficulty swallowing, especially if the nodule presses on the esophagus. Hoarseness or voice changes can occur if the nodule affects the vocal cords. In some cases, hyperfunctioning nodules produce excess thyroid hormone, leading to symptoms of hyperthyroidism. These can include unexplained weight loss, rapid heartbeat, increased sweating, tremors, anxiety, and difficulty sleeping. Conversely, nodules associated with Hashimoto's thyroiditis may cause symptoms of hypothyroidism, such as fatigue, weight gain, and constipation. It's important to note that these symptoms can also indicate other medical conditions. Therefore, if you experience any of these symptoms, it's crucial to consult your doctor for a proper diagnosis. Section 5. Diagnosing thyroid nodules, a step-by-step guide. Diagnosing thyroid nodules involves a comprehensive approach, beginning with a thorough medical history review and physical examination. Your doctor will palpate your neck, feeling for any lumps, bumps, or tenderness in the thyroid gland. Blood tests play a crucial role in assessing thyroid function. These tests measure levels of thyroid hormones, T3 and T4, and thyroid-stimulating hormone, or TSH. Abnormal levels can indicate an overactive or underactive thyroid, potentially linked to a nodule. Imaging tests provide a visual representation of the thyroid gland and any nodules present. Ultrasound is often the first-line imaging test, using sound waves to create images of the thyroid, revealing the size, shape, and composition of nodules. If a nodule appears suspicious on ultrasound, your doctor may recommend a fine needle aspiration biopsy. This minimally invasive procedure involves using a thin needle to extract cells from the nodule for microscopic examination. The results help determine if the nodule is benign or malignant, guiding treatment decisions.